A county survey shows some people in Macon-Bibb are struggling with mental health. Hello and thanks for joining us. I'm Lori Johnson. The survey launched last month hopes to get resources to people who are experiencing poor mental health from bad childhood experiences. Maggie Fitzgerald spoke with Macon Mental Health Matters about the county score and how they hope to expand access to the resources for the community.
Community leaders in Macon Mental Health Matters are narrowing in on highly impacted areas based on new results from Macon-Bibb's first ever public ACEs survey. The average score of a 4.07 shows parts of Macon currently experiencing high risk levels of childhood trauma. Community leaders gathered this morning to reveal results from the first Macon-Bibb ACEs survey. 100 people filled it out across 21 different zip codes. Questions covered adverse childhood experiences like abuse and neglect to identify where high-risk trauma is seen in the community. Christelle Parham and Andrea Cook say survey responders were connected with Macon Mental Health Matters resources after filling it out.
It informs the work that other agencies are doing to address trauma from a holistic perspective.
For sure. Those neighborhoods with higher scores were seen in the 31204, 31201, and 31210 zip codes. Residents there received scores higher than the county's 4 average. It means they're at a higher risk for substance abuse or mental illness.
That's a pretty sobering statistic for our community.
Christy Henry from Family Counseling of Central Georgia was part of today's panel addressing solutions to the results. She says she's empowered by the response from the community.
Very inspired by that and making sure that our agency, like I said, is trauma informed and meeting the needs of our clients.
Dr. Hannah Cespedes with Pacifica Counseling was also surprised by the numbers.
I audibly gasped when I saw those numbers. In the Macon area, I do hear these stories of our survivors of childhood trauma from many different angles, but as a researcher as well, there's also just something so powerful with seeing the number itself.
As for the organization, Andrea Cook says it's amazing to get support from Macon-Bibb to better understand the impact of community trauma.
We will channel our resources to the neighborhoods that need it most. But because we want Macon to be the most mentally healthy city in Georgia.
And the organization plans to make this an annual evaluation and intends on sending out the next survey in summer of 2025. In Macon, Maggie Fitzgerald, 13 WMAZ News.
The results of the survey will be available to the public on the Macon Mental Health Matters website tomorrow.